welcome to tonight's episode of Beyond Focus TV. I'm Lydia Patel, and as always, I have a very special guest for you, no stranger to the program, Dr. Suzanne Greenidge. She'll be with us tonight talking about fibroids, so stay with us. You're watching Beyond Focus TV. Beyond Focus TV allows you to discuss contemporary topics affecting the Caribbean people on both the national and local level. The show features informed guests who offer insight, debate, and evaluate various issues. Beyond Focus TV builds on the station's mission to provide useful information to the Caribbean people in New York and abroad. Beyond Focus TV, where our viewing audience can get educated, informed, and empowered. Welcome back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting here with none other than Dr. Suzanne Greenidge. Welcome back to this program.
Thank you, Lydia. Thank you very much for having me again.
We love having you on here because you author great information you always give us, so it's great to have somebody on the program who could come on a regular basis and really share some important topics. So tonight we'll be talking about a topic that a lot of women in the community actually suffer with, which is fibroids.
Yep. Fibroids, one of my favorite subjects.
Okay, and you know what? You did mention that.
That's
so
right.
You know what? I know we're going to get really juicy and kind of give everyone the nitty-gritty on what fibroids are. There's still many people who have heard of it. We've all heard of the term fibroids, but may not have. We're going to kind of zero in on really get to what they are, some of the signs. So we'll kind of go into that.
All right, great. So fibroids are what we call smooth muscle tumors. It's one of the most popular gynecological tumors that we have in our area. And they are solid things. A lot of people feel like they could be like cyst-like, like a water balloon filled, balloon filled with water, but it's not. They are like solid things. And I have some props here to show exactly what they look like. They are located in reproductive women, maybe 30 to 70% of reproductive women have fibroids. So they're in a lot, and we're talking all races, have fibroids. There's, it's known that black women have more fibroids, and they have up to 80% of black women do have fibroids, but it's popular in all races and all females.
So if you have fibroids, is it possible to have it and just not feel anything or go about your regular life and still have these and function properly? Or at some point, it's going to catch up to you?
Fibroids basically have no symptoms or they have symptoms. And those people who have no symptoms have no clue of what's going on. And usually your gynecologist will be the first one to tell you. So you don't have to have symptoms when you have fibroids. And the patients who do have symptoms, if you do have symptoms, so we could talk a little bit about what those symptoms are. The most common symptom that women have is bleeding problems. And that could be anywhere from irregular bleeding to heavy bleeding. So that's one of the most popular bleeding problems just in general that women complain about. Also anemia goes along with the bleeding problems. If you're possibly bleeding heavy, heavy being more than 7 days or more, that's a pretty heavy menstrual cycle, and one should look into seeking medical care to find out if they do have fibroids, because if you're bleeding for 2 weeks, that's not normal. That's not normal. So besides the bleeding problems, we then get into pressure issues. A lot of women complain of, I feel some pressure, something going on down there, a lot of pressure. Due to the pressure, you may be going to the bathroom a lot. You may be urinating constantly, getting up in the middle of the night to go to the bathroom. You may have some back pain. And you may have pelvic pain, but a lot of times fibroids don't give very much pain. A lot of women think, I'm going to have a lot. I don't have fibroids because I don't have any pain. Well, not all fibroids give pain. So that's another, myth that we get into, that you don't have to have anything going on, but a little pressure. So we talked about the back pain, we talked about the pelvic pain, we talked about when you have sex. Sometimes you have pain during sex. Women are like, well, when I can't have sex because I'm feeling this pain when I have sex. So these are some of the symptoms that, and also another topic which we didn't talk about is fertility problems. Women are not able to get pregnant, and they're not knowing why they're not able to get pregnant. So fibroids plays a role in causing some infertility issues as well. So these are, just a general history of symptoms that women can get or not get.
And that's a great overview when you think about it, because a lot of times, which I've heard, I don't feel anything, so I'm not in pain, or I don't feel pain, so you overlook it.
Right.
But then I didn't know they could also have irregular periods, like if it's on the lighter side, or anything that's dealing with either too light or too heavy could potentially be that.
Exactly. And sometimes bleeding in between periods. Some patients
Spotting.
have spotting and bleeding in between. They're saying, and also discharge. They may have a little bit of discharge, a lot of discharge coming out. And it's really trying to give you some signs that something's going on. And so pay attention. I want all the women listening to really pay attention to what's going on with your body. Don't ignore any of the signs. Make sure you go see your gynecologist to check your uterus to make sure that, if you have any of these symptoms, that we'll get into some of the treatments that are there for it, but that you check it out and make sure that, there isn't anything wrong. There are a lot of women who have menstrual cycles. They think, 10 days is normal.
Oh my goodness.
And, when I tell them that, no, that's not normal, all their life they've had this time period for their cycle, so they didn't know anything better. And they're wondering, well, why am I anemic? I have, I may need blood transfusions, or I may need, to use a super and a tampon and, all these things that they have to use in order to just, finish their cycle. So these things aren't normal, and fibroids can be the culprit of these symptoms.
And that is so informative. And sometimes when you think of it and you just look back at your own personal history, when I tell some girlfriends of mine, I'm like, I don't know what it is to have anything past like 3 or 4 days.
Exactly.
In my entire life. And I have had friends who almost 2 weeks and who went through surgeries. So that's how I kind of can relate to that, because I've seen 6 weeks of going down. But, once you go through it,
right,
it's like a life changer.
Yeah, absolutely. And I just did surgery this morning on a patient, and I did what we call an abdominal myomectomy. Her fibroid was this big, and that's about 11 centimeters. So I had to open her, and we'll get into some of the treatments for fibroids, but I had to open her and remove this fibroid, and then when I was done, her uterus is back down to a normal size. So she was lucky in the fact that she only had really one big one and maybe a few other little ones, and she was able to have it removed, and now she's going to be normal when it comes to her bleeding, her pain, her pressure. All these things will go away.
And what are fibroids filled with? It's just mass? It's just
they're
tissue?
solid, and we have just a little model here, which I wanted to show everybody. If you can zoom into it. This model is showing different locations for the fibroid. So we have fibroids that are located within the muscle. This, first of all, let's just do anatomy lesson. This is a vagina here. This is the cervix. This is the uterus. And these are tubes. And this is the ovary here. So these white things, if you can see them, are fibroids. They are located, I'll just get a better picture right here. They're located, if it's located inside, this is your endometrium or your lining where you bleed. And you can see this little thing growing inside of there. That is a fibroid. And if it's located in this location, which can be called submucosal, it will cause a lot of heavy periods. And sometimes they're located near the lining too and causing heavy periods. And this is in the muscle. A lot of times women don't know they have this particular type, and then we have the types that are on top here. Really? And those are the patients that say, well, I have no symptoms. I have nothing. I feel nothing. So various locations, depending on where they are, will cause different symptoms.
And what are the most common locations that you see?
We see them in all locations. As a matter of fact, I had one patient last week who actually was having what we call an aborting fibroid, meaning it had a stalk and it was growing through her cervix out her vagina. So when we put a speculum in, we could see it coming out, and it was causing her to hemorrhage and bleed. So she wound up having surgery to remove that, and that will be miraculous for her, and she won't have the bleeding problems anymore.
Wow.
Yeah. So they're located various places. Depending on the places where they're located, that will depend on your symptoms or, like I say, no symptoms at all. So this is a good little model that I'm happy to show everybody.
A great model, and this is so informative. I love that because a lot of times we really don't know what's going on with your body, and that's why it's so important to be in tune and really kind of get someone who could explain in more detail how that can go about. But we'll take a quick break. We'll be right back. You're watching Beyond Focus TV. Stay with us. Welcome back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting here with Dr. Suzanne Greenidge. So, Dr. Suzanne, so much information you gave us in the first segment. Really, I loved it. We really went into what it is. You showed us a great demo. And I actually learned a lot because I really didn't know that fibroids could be located in so many different places.
Yes.
And I know we're speaking offline. You were saying that you've seen some huge fibroids and multiple, like up to 50 you've had to...
Oh, yes. I've removed a number of multiple fibroids. We talked about them being benign, meaning non-cancerous, but there are, it's important to let the viewers know that fibroids can turn cancerous. There is a condition called leiomyosarcoma, which is, basically a cancerous type of fibroid. So there are a small percentage of fibroids that do, if your uterus is just growing and growing and growing, that's one of the things that we look for, do they have a sarcoma, rapidly growing uteruses. So, so in my surgical history, I've removed many fibroids from many different people, ranging in age from as young as 21 years old to older, 50s, 60s years old.
So even that old, people could still be having fibroids.
Oh,
could
they
it just
still
be
have
that they
them.
just didn't know?
Exactly. A lot of those patients had no clue that this was what was going on with them. Most of them, when they get older, we do hysterectomies for them, and we spare the uterus for patients who want children. We try not to do hysterectomies for our reproductive patients who haven't finished their childbearing. We try to save their uterus so that they can use it.
But if you're menopausal or past, or let's say a woman has already had 2 or 3 children, or even 1 child, and she's decided, she's done, is hysterectomy the best route to go then?
Well, it all depends. We don't do surgery on all patients who have fibroids.
Okay.
So that's, the first thing we need to get. There are a lot of women who have fibroids and they don't need surgery. When do we do surgery and when do we choose to do some sort of treatment is when women are having problems. And the problems we talked about in the first segment have to do with they can't stop going to the bathroom. They're having a lot of pressure. It's growing. It's very big. And it's causing constipation, or it may be causing back pain. And sometimes it even presses on your ureters, or the tube that connects the kidneys to the bladder. So this is when we jump in and say, you know what, we need to do something about it, because patients will tell us something's going on. I can't stop going to the bathroom at night. I can't have a life because every time I drink, I'm running to the bathroom. So that's when we say, we got to do something. As